Okay.
Firing the feisty Secretary General of KMPDU is now going through the document to sign the documents that represent the American with the national government. We really want to thank our council who worked very tirelessly from both sides, from the government side, from the KM's office, and the FG, and also councils Jasper Miyuki, Marno, Policy Prono, and all that have been involved in this whole process of negotiation, and even doctors and advisors of the Kukira, and why also we want to thank the senior council that have also been involved in this regard. Now the SP is also signing some of the documents that have been used by the service.
So what I'll do, I'll say all committees, all the parties, so finally agree and sign this contract. Thank you, and we hand over now. I've only addressed 2 minutes. So, was it done? Or we give it to them? Yes. Okay. No, I'll open it up. He set the pace of 1 minute.
Okay, we are now finalizing on the...
There's no exchange.
The last document.
After
What is supposed to put on?
So do we first say
ceremony? Itaitwa ceremony gani?
Okay, so what do you guys think? Ask them to follow. Don't suspend, follow.
Can you tell them to speak fast?
Yeah. So I follow you. And then after that,
They have to follow the steps.
all the signing is done. We are going to witness the exchange of the documents between KMPDU and the Council of Governors, and then we will minister,
Yeah.
and then the head of public service we will minister. And according then you call the others, so how will they go?
I will. No, you are. Once the affairs are ready, you will call the governor to come forward and exchange documents with the SG. Then after that, you will call her to exchange. After that, I will talk. Then I will invite them first of all to call off the strike.
Oh yeah, so having signed after exchange.
We want them to publicly call off. They will not. I'll tell them publicly. Because once you exchange, no, I'll say no. Whatever there is a process. You were anti-climate.
Thank you very much. We are finalizing the last document before we have the exchange of documents. The first to exchange the documents will be the chair of the Council of Governors together with the chair of KMPDU, the SG, I am guided, and then we have the minister. Again, they do exchange the documents, and then the head of public service will take over from there.
Ndio hapa kama inawekwa. Tumia kalamu yako.
Inanga makala. Enda huko.
Okay, choir, okay. Okay, thank you very much. Now you can see the chair of the Council of Governors. We want to call upon I'm told that the signing is not yet done. I think there are some 2 or 3. Why continue? Sorry, Madam Governor.
Down the way where the nights are gay and the sun shines gaily on the mountain top. I took a trip on a sailing ship and then I reached Jamaica. I made a
One and number one. The fourth was the It was 22nd. And then there was another 27th where I was not there. Ilikuwa leo jana. Ilikuwa jana.
I decided it's not good to open those things. When I show my toast, it's very good because
What ilikuwa they what?
it's a whole 3 days.
Kamwacha huko.
But you know something is up. These people are doing a very difficult job. You don't know.
Yeah.
They report on their own figures. Sometimes they are bosses. So I told them the government will take over the internal audit bill. They wanted to be a committee people. Nikasema hapana, nitaipeleka kwa domo. Nikamwambia over 60% of government is getting qualified audit reports. So by the time it becomes qualified, internal audit anakuanga wapi? So I tell you, why are we getting audit qualified account? Yeah. Internal audit alikuwa wapi?
Agree.
Kama ulikuwa na dhambi zote nimekusamehea. Ile barua iliandikwa Duba. Alikuwa ana appoint Patrick Ndali.
Nani? Hayo zote. Nilisema ongea na waziri yako.
Nilisema hiyo. Hata kama uko na dhambi nitakukupa pesa yako. Yeah, you need to copy me. I knew when you copied me.
Yeah, I said I was wondering now. How can
No.
You know there are some
hiki ni kitabu kimoja moja mbili na maendeleo yetu. Sasa mwenyekiti wa KMPDU ndiye anakamilisha kutia sahihi. Fikiri sasa tumeweza kumalizia hapo kama tunavyotazama, ili tuweze kufikia awamu nyingine na kuweza kukabiliana stakabadhi.
this one is gone.
Lakini tupatie nafasi ya ile ya kuta bongozi.
Hapa zaidi.
Zaidi tutanga watu. Namna hizo. Sasa tunafocus on productivity.
Ambao wamepigania sana haki ya wenzao na serikali ya Kristo kuongoza na mwenyekiti wao Mama Angoyo, gavana wa Kinyaga, pia gavana wa Tanzania ambaye ni mwenyekiti wa afya ambaye nipasi
Get a minute down. I can even leave now. Me, I always organize fade away.
Waziri ambaye anahusika na masuala ya umma, wafanyakazi wa umma, waziri ambaye anahusika na masuala ya leba, mheshimiwa Kole, na pia waziri wa afya Sasa kwa dakika moja inayokuja tutakuwa tumemaliza, ili sasa tuweze kuingia katika awamu mbio nyingine. Tunashukuru sana washauri wa rais, Daktari Buronera, Daktari Wai, kwa vile ambavyo wamekuwa na huo mtaku sana kati ya pande zote husika ili tunaweza kuwafikia umoja huu wa kitaifa. Tunaweza kumaliza nao wanakwaya tungependa kuita now we can call upon the chair of the Council of Governors, the chair of Council of Governors, Madam Anne Negro. You can step forward, and also the Secretary General of KMPDU, so that you can come forward and exchange symbolically the documents from the two sides. So please, you're welcome. Wapigie makofi wanapokuja. Makofi, makofi, makofi. This is a very momentous occasion, so that they can represent. These are the faces. Very proud that we've come to the don't have a course. So, whether you have each other, just shake hands. Let's clap for them. Makofi, 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 makofi. Now we will exchange the documents. Yes. Ningependa ukae wangwana kabisa vile ambavyo naomba msoge karibu hapa katikati. Haya, basi tuangalie picha. Thank you very much, our governors. Thank you very much, our doctors. Let's clap for them. Please hold on the documents. Hold on the documents. Maybe we can have one document to be given to the chair, just for symbolism. Chair, please, you can hold. Yeah, please hold the document. Yeah. Let's clap for them once again. And you can see very young doctors. This might be the doctor in Zambia or not wrong. You will be called for them. So thank you very much. Now let's have one more photo. Sorry, just remain there. Can you remain there for a moment? The ones who are holding the documents, just hold the documents. You can step aside. Can you step aside? Everyone will give the document to the chair. Can you? We need yes. Sorry, wait a bit.
It's a vice chair.
Is the vice? Yes. Yeah, but we have another document. Now, if there is no more, it's okay. Let's take this photo.
They are not the same.
Yeah, this is very good. Makofi tena, please hold it very well. This is very important. Thank you very much. We will now take your... Okay. You want me to send you solidarity for it? Solidarity! Solidarity! Now let's now have the next exchange of documents. Let's have the next exchange of documents between the doctors and the national government. And we will have the CES and the Secretary for Health, the Cabinet Secretary for Labor, and the Cabinet Secretary for Public Service, and also the SG. Can you join us because you are the custodian now? We need to repeat the... Okay, I'm told that we need to repeat. I'm guided.
Let them finish.
The eminence. Okay, thank you. Hiyo lazima ingie hapo. The eminence must be right. Makofi tena. Thank you. Good. Let's have now the national government. The national government represented by the three cabinet secretaries and the Solicitor General. And also the two PSs in the Ministry of Health, Harry Kintai and Mary Doni. And also, please, may you come and line up so that we are properly I don't know whether KMPDU want to add on to your people, you're okay, the two of you, because the national government looks it has outnumbered you. Maybe some of the other people can join, but it doesn't look. And then in the middle, let us have the head of public service. The head of public service, sir, thank you. You may request him to come, because you are the custodian of all. So kindly, let's move a little bit. Let's try it. Move it up. Let public service be at the middle. And wait a little bit. Hiyo picha, Madam Susan, kuja upande tafadhali. Nakuomba ndio wakaribiane. Hapo. Basi. Hiyo ndio picha ya. Let's clap for them. Makofi, makofi, makofi. Thank you very much. Now we can have the exit of the documents, kindly. Let's have the exit of the documents, symbolically. Please, the key stakeholders, you may hold. And this is a very important document, that's why it's in red. And Wakili Collins Kiprono is handing over. Yeah, please hold them so that we see the emblem formally. Yes. Yeah. Yes. And let's be on the same line. Let's be on the same line. Yeah. Let's be on the same line, kindly. Uniformity. Yes, kindly. Chair, you may want to also do the same. Yeah. Wamefungua vitabu vya makofi kwao. Ski inua yangu kidogo, yako inataka mbele kidogo, usiambiwe ilikuwa sahihi. Makofi tena. Please let's clap for the I'm trying to build a makofi. Thank you very much. Let's shake hands quickly, just for symbolical. Musalimiane, salam, happy. Oh, unataka kusalimia. Mimi niliwapeleka mbio sana. Kama msemaji wa serikali. Kwanza hiyo makofi. Kama hakuna sponsorship kwa hashtag kwa Twitter, hiyo makofi sasa. Tunakimbizana huko kwa hiyo. Salimia bwana Kuria pia ni mwingine kwa sababu kuingiana hapo. Daktari Daudi, salimia mheshimiwa wa Kuria. Alikuwa upande mmoja hapo kwa chana sana kabisa. Na pia waziri wa leba, Lawrence Boren, ambaye ni mama ambaye alikaza nguvu kabisa. Asante kwa kujua. It is very, very symbolic. Everybody is happy. And also the SG, yeah, hapo kabisa makofi. Na pia Madam Mary Mudoni, ambaye alikuwa ni kama mediator kidogo, alikuwa na middle ground kidogo, alikuwa na nia tusisukume sana. Pia Sari Kitai, yeye ana maneno mengi, pia Sari Kitai. Salimia, salimia. Lakini haya, hata mimi nisaidie hapo. Nisungwana sana. Na tunaanza kuketi au inataka sisi? Oh, CS Public Service, sorry. Thank you very much. CS Public Service, sorry. I beg your pardon. Take our seats now. So you said I called them, did you? Mimi zitaongea, mimi nataka tu niseme tu mbele. Asante sana. Asante kwa asante sana. Now, let's be silent. Let's be silent. Please, let's clear the front here. We can clear the front. We can clear the front. Now, at this juncture,
airport. Okay.
Silence. Let's be silent.
Yeah.
I can see some people at the back a little bit active. Let's just be calm. Chair, you may want to take your seat. And I'm very sure that bag is not yours. Chair, we are ready.
Yeah, I'll take 3 minutes. Me out on that.
Thank you. Now, at this juncture, I want to invite, I have the pleasure to invite the chief negotiator of this whole process. It's been arduous, many days on end. This has been where we are camping, but finally, we have a solution. Let's clap as we welcome the head of public service, the Honorable
Good evening, ladies and gentlemen. On behalf of whole of Nation Approach Committee, I want to register my appreciation today, this evening, for the ceremony that has taken place. It has been a very, very tedious and windy, very rough, but finally we have made it. I want to thank the union, I want to thank the ministry, I want to thank the county government led by Her Excellency Governor Anne Waiguru and her team, and also to again thank the CS Health and also our team for really being patient, working very hard during negotiations, and ensuring that whatever was at contestation was finally agreed. And I want to thank also KMPDU for climbing down. And now we have a document that has been signed formally, a document that will be deposited in court so that we as Kenyans will start again enjoying health services as provided by the doctors. I want to, as I'm ending my opening remarks, I want to request the union perhaps to start by calling off the strike officially, because I know Kenyans are waiting with a bated breath. Karibu KMPDU, and we are making very, very short speeches because we want to rush to court. Karibuni.
Stand up. Are you going to stand up?
Where did you sign that thing? Where did you sign that thing?
Okay, now let's hear from the SG, who is the spokesperson of the doctors.
Yeah, thank you so much. I think today marks 7 years and 56 days since the government has been on strike. But we are happy that they called off their strike here 5 days ago, and this led us to have a well-structured negotiation that was having a process of give and take. So yesterday, we had a negotiation with the Council of Governors, and then we proceeded to have a whole night negotiation with the Ministry of Health. So I want to thank the head of public service for having complied to the court orders, because court orders are not given in vain. And that led to the meetings that we had. I also want to thank the Council of Governors, headed by the Chair Anne Waiguru, and the Chair Health Committee, Governor Mudomi, and the Chair Labour Committee, Kahiga, who have met us on several occasions. Sometimes they throw tantrums, but they still believe that we have to sit down and resolve the issues. I also want to thank the Ministry of Health, the CS, with the PSs, who despite the heated moments have not given up on having discussions onto these issues. I also want to thank the able leadership of KMPDU, who believe on one thing, that justice must be done and must be done now. And so from the document that we had a very long meeting today with our National Advisory Council, that is the highest decision-making organ. And they endorsed that we signed this particular return to work formula today so that it can pave way for the doctors to resume work within 24 hours from now. And that means the strike that began on 13th of March 2024 has been called off. The government has insisted to us that they are different government and there are different persons in office, that we need to believe in them, that they are not conmen. And therefore, we have decided that despite having said and stated that we do not go home with promissory notes, we have decided to take the promise for the last time. But as we take this, I must say that one of the fundamental issues, that is the matter of doctor interns, is still pending. This matter was filed in court in Eldoret. This matter has been part of the conversations. And we could not come to a particular agreement because the union was for the opinion that the doctor intern must be posted immediately as per the CBA, while the government was for the opinion that we have to await for the court litigation that is ongoing in Eldoret before we come to an agreement. But there we have a joint caveat that as that is going on, all the doctor interns, that is the medical officer interns, the pharmacist interns, and the dentist interns will have to wait a little bit longer. We have agreed on a 60 days period that they will not be posted, but we'll be having conversations on this issue. It then means that as this matter in court is ongoing, we'll also be having conversation. But one thing we must assure everybody, every doctor and every person, that the rights of workers as enshrined in a collective bargaining agreement that is signed, that is sacrosanct, we will always endeavor to protect that. Thank you.
Thank you very much. That is a very excellent speech. Now we turn to the Chair of the Council of Governors. Please, you can help me move the mics. The Chair of the Council of Governors, Madam Anne Guru, the Governor of United.
Thank you very much. On behalf of the Council of Governors, I would like to say how pleased we are and relieved that finally we have come to the end of this strike. It's been a long journey, many nights, many days of negotiation. And if we were in a boardroom, I would have said point of order, because I don't think the governors were throwing any tantrums. But in the process of negotiation, there is give and take, and there is that which can be done and that which can't be done. Most of the issues that had been raised for the Council of Governors had been agreed upon a lot earlier. And in the process of harmonization and the issues that kept emerging, it took a little longer. But we are saying today is a great day because we have come to the end of this issue, and we would like to thank the union also for coming this far and working seamlessly with county governments and agreeing on all the issues that were raised and the responses and the timelines that we've given, and therefore also calling the strike off. So on behalf of my colleagues, we want to say thank you, and thank you also to the head of public service steering the moderation between the two parties and also for the national government. So we thank you. We would also like to note that we will be continuing with the process of dialogue and negotiation with the other outstanding institutions that we haven't yet settled, because the commitment of the Council of Governors is to ensure that we're providing seamless service delivery to the people that elected us. Thank you once again, and thank you for making the time to be here.
Makofi. Now let me call upon the Cabinet Secretary for Health to take her remarks. I can see some governors want to make some remarks, like stand so the chair has.
I'll move for you when I finish, because you don't have to move. Thank you very much, the government spokesperson. I want to support the remarks that have been made by our chair. On behalf of the Council of Governors, we are grateful also to all the parties involved, HOPES and CS Health, the KMPDU, and everyone else who was involved in these negotiations. We have burnt midnight oil and we have worked overtime. Some of us have not been to our counties for a very long time, and I hope our constituents know where we've been. It's for the greater good for the country. And now we are happy that we can now be able to go back to our counties and be able to see the implementation also being discussed today. It is easy to put a signature on the paper. It is easy for KMPDU to just pick the mic and say we have called off the strike. But the real work begins now. The implementation of what we have agreed upon is the beginning of the journey to make sure that we never have any more of this and call for disagreements that lead to strike. For the beginning, we have their need for the health for people of Kenya because of the floods. Cholera has just struck in some parts of the country, and therefore what the KMPDU SG has said that the doctors can go back within 24 hours. The 24 hours should begin now. SG call on for duty. Health cannot wait. We'd even wish they can go back in the next few minutes because we really want our health to be back on track. On our behalf, we will continue engaging, as our chair said, with the remaining unions, that is Kenya National Union of Clinic Officers. We had agreed to meet them on Tuesday. We'll meet them, but we are hoping that because they've seen the goodwill that we have, and we mean good for them, they also can go back to work, and we'll continue negotiating as they work because we are available for them. Thank you.
Thank you very much. Governor Kahiga, do you want to say something? In the spirit of equity, into two levels of government.
Thank you very much. I also would want to associate myself with the sentiments of my colleague, the Chair Health, and also our Chair COG. And I want to say that being a new chair in the Council of Governors and the Labour, my commitment is to ensure that together with my colleagues, we will deal with all outstanding labour issues. And what we have exhibited through this strike is our willingness to engage, even when it is so difficult to do that. And I want to really appreciate that KMPDU has finally agreed to call off the strike. My message to all unions is that you can never solve the issues of workers in a single strike, because if you did, then we would need to disband all unions. And therefore, it should be a give and a take, and you take home the gains that you gain and then live to fight another day. In other words, we are saying, do not win a battle and lose the war. It is important that we work together. Even for other unions, our commitment is to ensure that we will address all issues, we will address all unions, and we will work according to the law. Those that need to seek recognition, they know the processes and all others, and we are ready to do that. Finally, may I call upon all the doctors to redouble their efforts now that we have called off the strike. As the Secretary General has just said, we should have done this by yesterday. We need to now get down to work. We should now get down to work and do the very best we can. I'm saying that because the SG has called off the strike. I have no power to call off the strike. But I'm saying the SG has done that, and therefore I would want to call on the individual members, let us get back to work. May I end by saying I want to thank national government for its commitment towards this process. We have we are joined at the hip. There are quite a number of things that we have to work together to ensure that we fulfill the dictates and the likes and of the agreement. Mine is to wish you all the very best and to say it's been a tough journey. I thank everyone who participated. Thank you very much.
Makofi. Before we move back to the national government, the chair, KMPDU, would want to add some voice. Kindly let's move the microphone. Chair KMPDU. By demand from his members. And then we move to CS Commission, who will also introduce the two CSs we've had. And then we turn back to the head of public service. Then we close with the national anthem. So, choir baby. So, chair. Chair. Wacha aseme kwa sababu ya wapiga kura wako. Now let's listen to the chair.
Thank you. I don't think there's anything much to say. I've never been of an opinion that in an industrial action which ostensibly involves the loss of lives, that there's any win. If at all there's any win, it's called a Pyrrhic victory. A Pyrrhic victory is a victory whereby, even though there's a medal at the end, the other side, the losses along the way are just too heavy to even celebrate that win. And since we've been here before, my word of play will be that we should never find ourselves in such a situation. And governments upon governments have been sitting on their ambulance, and it takes the unique power of unions to put fire under their feet so that they jump into action. We should never get to such a position. There is no victory because it's like a hostage situation. But since we have this circumlocution documentation and ended up with a document that is so fit to put pen to paper, speaking as a doctor and back to Hippocrates oath, this is it. It should not happen again. Thank you.
Now we move to the CS. Susan Afucha, please you may move the mics to Madam Afucha. Madam CS, you can also quickly introduce the colleagues. You can also represent the national government. Pole kwa majeruhi na maneno. Wewe ni mama wa nguvu. Madam CS, you have the floor.
Thank you very much. The Head of Public Service, my colleague Cabinet Secretaries, Cabinet Secretary for Labour, my sister Florence Gore, Cabinet Secretary for Public Service and Performance, Moses Kuria, my Principal Secretaries present here and all Principal Secretaries present, the leadership of KMPDU, starting with the Chair, Dr. Mwachi, the SG, Dr. Davji, and if I don't mention the Deputy SG, he will feel bad, Dr. Miskela, and our chair for last night, who assisted us to make progress, Dr. Shisanya. All healthcare workers across the country, fellow Kenyans. After long and painstaking negotiations that ran into the wee hours of the night for many days, I am pleased that we are finally here we have signed a return to work formula, and the union has called off the strike. The negotiations have been tough and protracted, and I want to give it to the doctors. I thought that I knew how to negotiate and bargain, but obviously they have been very good at this, better than myself. On several occasions, we came close and indeed thought that we had arrived at a deal, but it was not to be, and we kept the country waiting. However, I want to say last night, we all found a place in our hearts to agree. And this is testament to the apostle of Paul to the Philippians. And he said, do nothing from selfish ambition or conceit, but in humility regard others as better than yourselves. Let each of you look not to your own interests, but to the interest of others. This agreement could not have come at a better time and without the commitment of all stakeholders involved. I want to sincerely thank the team from the Ministry of Health, my two principal secretaries, Principal Mary Mudhoni Moriuki, Principal Harry Kimtai, the Director General, Dr. Amoth, and all the officials from the ministry who have worked together with me on this issue. I also want to thank the Head of Public Service, who, under the Whole of Nation Approach Committee, has led us into these discussions. The Council of Governors, for their deliberate effort to ensure that we get a solution, and to my colleagues who have been besides me in all this. Equally, I want to appreciate the conciliators from the Ministry of Labour, together with KOTU, and the Labour and Employment and Labour Relations Court, for stepping in and being patient with all of us as we went through this. To the family have wondered when the strike will end, we understand your pain. There is no denying that this strike has caused a lot of anxiety and pain among the public, especially at a time like now when we were accelerating access to universal health coverage. However, I must in a special way applaud the many doctors who remained at work during this strike, and all other health care cadres, such as the nurses who kept our facilities operational, and of course, our community army of the community health promoters for their important role as first-line health workers at the community level. At such a time when the country is going through the flood crisis, with the deaths that we have experienced, with over the 40,000 households displaced, I can never appreciate the health workers enough, because this is the time now for us to work. Fellow Kenyans, and especially the health workers, the issue that led to this strike are systemic issues that precede the Kenya Kwanza government. And it is for this reason that I consistently emphasize that first, we must make an agreement that we can implement. And second, we must find a lasting solution to the perennial issues. I am confident that what we have signed on to today, having consulted widely, this is a deal that is going to be implemented by all of us. Last night, we left the Ministry of Health at 3 a.m. And the deal breaker was, is this a deal for execution or just for signing? And we agreed that it was a deal for execution. This strike has given us an opportunity to introspect and look inwards to see what can be done better for health workers in this country. On Monday, my colleague C.S. Machogu and myself inaugurated a joint task force to look into the production of health workers. And within the next 90 days, the Ministry of Health will also review existing staffing norms and standards, which were last published in 2016, and this will set forth the stage of us filling the gaps that have existed within the health sector. The reforms that we are undertaking are cognizant of the fact that health is a devolved function, with the HRH component shared between the two levels of government. And given this reality, it is imperative that all discussions and agreements regarding human resources acknowledge the distinct employers within the health sector. As a ministry, we are committed to this principle, and any future agreements that we enter, including CBS, will be based on this constitutional reality. I also call upon the unions and their representatives to be mindful of the need to strengthen the employee-employer relationship to build mutually trust that will resolve future conflicts for the benefit of wananchi. We have agreed that we are going to establish a presidential task force to look into the perennial issues that affect the health sector. Finally, now that we have a return to work formula, my friends, let us go back to work. All the names that you called me, I want to wash them away today. And should we as a ministry have erred in any way, today marks a new beginning. I want to urge all of us for now to focus on service delivery and make your rightful contribution to realization of UHC. The country has waited anxiously for 54 days to see you back to work, and they have a right to demand and expect to be served without further delay. My appeal to you is that please, forever, be truthful to the oath. If you are in public service, prioritize service delivery in these public hospitals. Let Kenyans get value for their taxes by receiving quality services in a timely manner. As a government, led by His Excellency the President, Honorable Dr. William Ruto, we appreciate the important role that all healthcare facilities in the private and faith-based play in delivering health services. Our position is that if you have chosen to serve in public health facility, please dedicate yourself to that cause. Thank you very much. Asanteni sana. God bless the union. Viva! Asanteni.
Maybe they want to recognize your colleagues.
Oh, I have recognized, but I want to say thank you very much, my sister Florence. You put together a conciliator committee that worked very well, together with Kotu, that has led us to where we are today. And my colleague, Cabinet Secretary Moses Kuria, he for she, I really appreciate you. You said the hard words that people did not want to hear. But thankfully, the truth is what has set us free today.